So I just wrote a blog for the website at www.amarillochiropractor.com, and thought I would go ahead and include it right here on my Creekstone website. So I'm Dr. Jeff Williams, Amarillo, Texas, and so this one's called 6 Facts About Cold Laser You Should Know Before the Next Injury. As the years go by, cold laser therapy has really gained more and more research backing it up. Its effectiveness at this point really isn't even in question. For those unfamiliar with its use and its effects, I thought I'd run down some basic facts to help familiarize yourself with the therapy. So these are things you may want to have filed in the back of your brain should you suffer a condition in the future that might be treated with cold laser therapy. Basically, the laser is used to emit a high-intensity light that it can treat chronic and acute pain while also stimulating healing and reducing the inflammation, which is a common cause of pain. So, number one, although it sounds like cutting-edge technology, cold laser therapy, really, it's been around since the mid-50s. The best part about cold laser is that it's non-invasive and it produces virtually no heat. So, that's nice, obviously. There's really few side effects and only a handful of reasons that you wouldn't want to use cold laser therapy. Number two, the next thing you need to know about cold laser is that it's not cold. That's kind of a misnomer. It gained the name to signify the fact that it's not a cutting or burning laser. Some cold lasers, they can't be detected because the heat's very slight. Sometimes you can feel it a little bit, some warmth, but certainly nothing hot and nothing cold. Another name that is commonly used to avoid confusion is low-level laser therapy. Number three, surgeons have begun using cold laser for post-operative incision healing to speed the healing up and reduce the scarring. Podiatrists, they're using cold laser for plantar fasciitis. And we, as chiropractors, we're using it extensively for things like muscle strains, ligament sprains, plantar fasciitis, inflammation, nerve pain, to increase the speed of healing of the soft tissue and musculoskeletal complaints. And number four, a great aspect of cold laser therapy is that chronic conditions, they can be controlled through regular periodic treatments, while acute conditions almost always fade rapidly. Cold laser is not only wonderful at reducing treatment time, and it's cost effective as well. Common conditions treated through cold laser therapy, they include athletic injuries, arthritis, lower back pain, knee and foot pain, shoulder pain, carpal tunnel syndrome, most other neurological pains, fibromyalgia, muscle spasms, TMJ, joint pain, soft tissue injuries such as sprains, strains, tendonitis, and tennis elbow, chronic pain, Bell's palsy, plantar fasciitis, musculoskeletal injuries, chronic wounds that are having difficulty healing, anti-inflammation, and disc herniation. Now, number six, some common results of cold laser therapy. So, rapid disappearance of pain, strong reduction of inflammation, rapid recovery from injury, immediate improvement of blood circulation at the treatment site, faster healing of virtually all soft tissue injury. Now, since we commonly discuss research on this blog, why don't we just go ahead and get into a little bit of it. The first paper I'm going to talk to you about is from 2014. So why they did it. The authors, they were trying to evaluate the various effects of cold laser therapy on the dorsal root ganglia that had undergone chronic compression. So chronic compression of the dorsal root ganglia is seen commonly following physical injury of the intervertebral foramen, causing the nerve damage. So how they did it. The study was performed on rats. The rats had artificial compression of the dorsal root ganglia in the 4th and 5th lumbar vertebra to simulate chronic compression. And then cold laser therapy was applied to test the effectiveness. Now, what they found, the outcome assessments showed that cold laser significantly lessened the pain period. Now, to wrap it up, cold laser showed the ability to enhance neural regeneration, following chronic compression of the dorsal root ganglia, which improved movement in the rats. In regards to the therapeutic effects of cold laser, there was reduction of inflammation. So that is pretty amazing stuff right there. This next paper has to do with cold laser's effect on chronic osteoarthritis in the knee. Now here's why they did it. The authors of this paper, they were looking to estimate what effect cold laser therapy would have in regards to pain and performance with patients suffering from chronic osteoarthritis of the knee. And here's how they did it. The study included 40 patients with osteoarthritis of the knee. They were randomly selected into different groups. One group was a laser group, the other was a placebo group. 8 different points were treated in each session. Cold laser was used 2 times each week for a whole month. They measured the pain intensity upon resting and on movement. So they measured knee function, they measured walking statistics such as the duration and difficulty in walking. All measurements were taken before the treatment as well as after the treatment. And here's what they found. The laser group showed significant reduction in pain intensity when resting and when moving. The laser group had a significant increase in function of the knee. The laser group showed significant increase and the ability to walk longer distances and longer periods when compared to the placebo group. So to wrap it up, they decided that cold laser was shown to be a significantly effective modality for pain relief and function in patients suffering from chronic osteoarthritis of the knee. And that's pretty big because it was a blind randomized study. So I hope you've enjoyed this blog. Please feel free to leave a comment and tell me your thoughts. I'd love to hear what you think. Be sure to subscribe to our YouTube channel and share, share, share. We cannot make a difference without your words and without your help. Till next time, I'm Dr. Jeff Williams, Creekstone Integrated Care right here in Amarillo, Texas.